Hi, this is Yisha Liu. Today is November 3rd, 2024, Sunday evening. And this is my whiteboard for this presentation. On the front is the 3 diseases associated to the syndrome I picked. The back is the other 3 syndromes that are in the urinary system. So the topic I pick up today is to talk about the urinary hemorrhagic syndrome. That is a condition you will see the blood in the urination. And usually, most of the time, it could be the cause is by infection, medication, or autoimmune system dysfunction, radiotherapy or chemotherapy by the medication, or the most important things is the infection. It's caused by infection either in the urinary bladder or at the urinary tract. And the symptoms or clinical manifestation that for this syndrome is, of course, by the definition of the name. It's the blood in the urine, and besides that, sometimes patients they will feel fatigue, and sometimes it could have fever, sometimes it could have not. It depends on the location of the infection, and patient will have the urge to feel like he or she needs to urinate very frequently. And it could be painful, have the pain sensation to pass the urine. And so the disease that under this syndrome, I pick up 3 diseases. The first one is cystitis. Cystitis is the infection in the urinary bladder. And most of the time, the cause of the infection is by the bacteria. Those bacteria, okay, so take another step back. For the human's anatomy in the abdomen area, it's the GI tract, and then more at the bottom of the trunk is the urinary bladder. So inside the cavity, if the bacteria in the GI tract, they travel down or they immigrate to the bottom part of the cavity, and that if also by the time the human being, the host, has a weaker immune reaction, and it will give the chance for the bacteria to kind of, we call that is the host reaction. It kind of provides the opportunity for the bacteria to resident in the urinary tract, and then it can travel up to the bladder and cause the infection. So one of the diseases is cystitis. And the second disease is caused by radiology treatment or radiology therapy. So usually if someone has the pelvic cancer and it needs the radiation therapy to treat the cancer, and the radiation might damage the tissue of the bladder, and that will cause the radiation cystitis. And the third disease is called the chemical therapy induced cystitis. Is some of the medication for the chemotherapy, such as cyclophosphamide. This medicine, it can be toxic. To the bladder tissue, and so it will cause the inflammation to the bladder, and then it will leading to the bleeding in the urination. So that's the three diseases: the cystitis, and radiation cystitis, and then the chemotherapy-induced cystitis that will cause the inflammation, and then it will lead to it will cause the infection, and then it will lead to bleeding in the urination. And the next one is the other three types of syndromes that's related to the urination system. So the first one is the acute renal failure. So the acute renal failure is talking about the situation or the condition where the patient, they will notice the urination output decrease, but at the same time, they will feel fatigue and short of breath. And then also, if we observe the patient, we will see there is edema at their lower part of the body, around the knees or the ankles and the leg. Yeah. And if we do the culture test, it will show maybe a higher percentage of volume in the protein, or you will show the test with the urination. It does not necessary to have the blood in the urination, but how to differentiate this with the hemorrhagic syndrome is hemorrhagic syndrome. You will see the blood cells in the culture test, and then most of the time, the acute renal failure, it impacts the kidney's function more than the bladder. Yeah. And the next syndrome is obstructive urinary syndrome. So this one is the patient will have the difficulty to pass out the urination, and sometimes the patient will have fever and also have the urgency to go to the restroom. And most of the time, it probably is because it's kind of the obstruction, right? So there is something to cause the obstruction. And usually most of the time, that's the kidney stone in the system. And so that kind of block the pathway for the urine to pass out. So this is called obstructive urination syndrome. And again, compared to the urinary hemorrhage syndrome, again, the hemorrhage, you will see the blood cells in the urination. So the urine color might change a bit, more like orange or kind of a pale red, but it does not necessary to be under the obstructive urinary syndrome to have the urine color change. The last syndrome in the urinary system is the nephrotic syndrome. Nephrotic syndrome, again, is related to the kidney function more. So it's not really impact the bladder. This syndrome most have a character is that if you do the urinary culture test, you will see a higher percentage of the protein in the urine, and it may have blood or it may not, but again, it's kind of related to the kidney's function to filter the proteins. So the kidney's function is damaged either by the disease or by radiation or by other factors. And so the kidney, it cannot really filter out the protein very well. So that's why a lot of protein is just draining out from the system, and that's kind of leave a higher protein percentage in the urination. Okay, so this is my presentation today, and thank you for watching.